So I'm not, and not being like an organizer, I'm just gonna still take my cue for like when to kick it off. So I'm just standing by.
I think you should kick it off right now.
Okay.
Mhm.
Well, for those who don't know, my name is Gregory Davis, and I'm the managing strategist at Rainier Beach Action Coalition, where we seek to engage the neighborhood and empower the community. I'd like to welcome you to this education opportunity to learn about vaccines and boosters. What's the point? I have to say that it could probably go without being said that we are in unprecedented times for most of us, for probably all of us, and that the things that we are experiencing in this day, although history has repeated itself, because I'm also thinking about the Spanish flu, and I'm wondering how Black folks dealt with it back then in 1912, I think it's 1912 is when it happened. Seemed like we made it through that, even though we were in as challenging a position then as we are now. But for us, it's unprecedented. So for me, the critical nature of this opportunity tonight is around education. As formerly enslaved people, we weren't allowed to be educated. We had to educate ourselves. And when we were able to rise up from being enslaved, education was the number one thing that we had to pursue. And it was no question across our community. It was education, education, education. And so this is what we're operating here in the spirit of education. We've got to embrace this opportunity to learn, to apply it to our lives. We are the results of 10,000 prayers from our great-great-grandparents, in being here in this day. And they struggled, they sacrificed for us to be here. So let's operate and function in the spirit that they prayed in, that we value education above all, if not for only ourselves, but also for the generations to come. So that's the spirit that this is in. I am happy that all of you are here, and the expectations that we will grow from this and be better at what we are setting out to do. So I just want to thank the King County, Seattle Public Health, and Belinda, our smooth operators team. Appreciate you. And also thank you, Brother Chris, for being with us, share this knowledge with us.
My pleasure, and thank you.
Tina, you're on.
All right, thank you for that introduction, Mr. Davis. So I just want to, reiterate what Mr. Davis said and just welcome everyone. Thank you for joining us for this very important information session related to all of our good health and sustainability as a community. We first want to acknowledge that we are on the Duwamish land, the land of the first people of this area, and we want to give honor, respect, and recognition to their history and continued struggles. Here we are today to talk about getting vaccinated against COVID-19 and all of its variants, knowing many of us in this room draw on our own history and distrust of the healthcare system and to make decisions during times like these. Today, we are able to get our information from people on TikTok, TV news, and other social media outlets, and base many of our healthcare decisions on that information without consulting experts. Today, we want to bring you medical expertise to help us make an informed decision to get vaccinated against COVID-19 so that we can get past this era of our lives and move on to better days. I want to welcome Chris Porter from King County Public Health. Chris Porter has been a healthcare provider for more than 15 years. His background is in infectious diseases and travel medicine. He has lived in Seattle for more than 15 years as well. He currently works for Seattle/King County Public Health as a project program manager in the community vaccine events. He is an avid cyclist, conservationist, and beekeeper. His goal is to keep community safe by answering questions about health, safety, and vaccinations. So I'm going to pass it over to you now, Chris.
Thank you so much, Tina. So what I'm going to do is jump right into this, but make it abundantly clear there are no stupid questions. There are no unusual questions. They're just simply questions that I want to answer that keeps people safe and keep us alive. So I'm just going to jump into this. And again, if you have questions, let us know, put it in the chat. We want to make sure everyone has an opportunity to have their questions answered. So vaccines and boosters, what's the point? And that title came as we were discussing what were we going to name this. And one of the panel members said, you know, what she'd heard is like, people have reached this point, like really, what's the point? Why even bother with this, with the barrage of news and information that we keep hearing? And I want to share a personal story that I think best answers that before we get into the nuts and bolts about vaccines and boosters. So just before, I would say maybe 6 months before COVID was identified in Kirkland, Washington, I realized that my stepbrother here in the bed, he and his family had been living down in Spanaway for quite some time, and I just simply didn't know it. And we had reconnected after a number of years. It was simply a surprise to me. And the adjoining picture are other family members and husbands and wives and boyfriends and girlfriends and pets. And when this first got started, I, as a trained healthcare professional whose background is infectious diseases, thought, oh, this is much like the common cold. And usually it burns itself out before the summer and life goes on. So there's not that much to worry about. Well, obviously, there was a lot we didn't know about this particular varietal type that they call coronavirus, which we're now referring to as COVID, and the impact it was going to make. And it first made an impact on me and my life and family long before there was big news about it. So I got a email from a family member who told me that his wife here had been hospitalized. And when I followed up and to try to figure out what was going on, she'd been hospitalized for COVID. And I think it was a day or two later, she had been released from hospital. The problem, and what made me really think about the impact it has on Black and brown people, was that he had, of course, as I told you, had been released from hospital. Maybe I didn't say that. Previously to that, he'd been released from hospital. He'd had a stroke, he'd had high blood pressure, and his kidneys were failing. She was his primary provider of care in the home, and he relied totally on her. So she goes to hospital, is diagnosed with COVID, is there for, I think, 10 days, is discharged and barely has the strength to stand or eat, let alone care for him in the very intensive needs that he had. She had to call on family members to come to the house. While she stayed in one part, he stayed on the other side, and they provided care for him. And it just brought it home to me, the impact that this was going to have on our lives. And it hit me there, it hit me personally. And when the vaccine became available, there was no doubt to me what the point was, that whatever we can do to prevent this scenario from playing out, where families are struggling, a family member gets sick, or maybe even dies, that's how serious it got. And that's how serious COVID came into my life and impacted me. A lot of questions about the safety of vaccines. How
Chris.
safe? Yes.
Sorry, are you sharing your screen? Because
Oh.
I can't see it yet. I wasn't sure if you were going with your slideshow yet. Sorry to interrupt you.
Thank you. You know, that is an excellent point because I just jumped right into the yes. So what I was explaining is there's my half brother and who had been hospitalized having had a stroke. His kidneys were failing, and his wife over here that was his primary care provider in the home, who'd gotten COVID, was sickened by it, had 8 to 10 days hospitalization. And even to this day, she still is not back at 100%. She's what the literature describes as one of those long haulers, which is she's still suffering from the effects of COVID with fatigue and energy loss, lack of full mental clarity. Those things are still very real for her. And so again, she had to call upon family members to pick up the care where she couldn't, because she had to isolate on one side of the house while he remained on the other, living with the fear that she might make him sick. And of course, he has all the things wrong for him that puts him at the highest risk of having a poor outcome should he gotten infected or gotten COVID. Again, none of that happened, but she still lives trying to recover from it. And again, that's how it impacted my family, came to me, and I realized early on how serious this was. So there's a lot of questions about the safety of vaccines. How safe are these vaccines? And that's a really important question, because we're talking about, I think, and the executive director, Mr. Davis, said it beautifully. We're in uncharted, unprecedented waters, and things are moving quickly. Well, they were able to rely on previous history of making vaccines. Some of you probably remember Ebola, when Ebola was in the news and people were getting it on continental Africa and certain countries and being sickened and dying immediately. The first vaccine they made using this messenger RNA was seeded around Ebola. So that information was there, that knowledge was there, and they used that to see if they could make a vaccine to address COVID. So it wasn't that there's not a history or experience with it. It was put on the shelf and they pulled it off the shelf, asking the question, could this help at this very critical time when we so desperately needed it? So the quickness with which it was made was because that experience in making this vaccine from RNA had already been done some 10 or so years ago when Ebola was a thing. And that's one of the things that it doesn't get told about the story, is that the technology is really not new in how this vaccine was made. It was just simply sitting on the shelf, because one of the features of Ebola is that when people get it, they die quickly. So there was not a need to use the vaccine. There's also the question about side effects. A lot of people are worried about side effects. And we live in a society where there's really a pill for everything. So asking questions about side effects makes very good sense. Not to mention the huge news surrounding side effects around the Johnson & Johnson vaccine. And I know we are part of a community that does not automatically trust the medical establishment. You name the reason and you're certainly valid. So asking about side effects is not a big leap. What we do know is that the common side effects is just like when you receive a flu vaccine or tetanus vaccine, is soreness in the arm where you get the injection. Some people may have light chills relieved by Tylenol or Motrin. They may have body aches, which last for a full day. Those side effects are much different than what we call adverse or serious effects, which is someone breaks out in hives, like they're having an allergic reaction. They get very short of breath. Their heart rate goes extremely high. Those are very serious side effects and happen in a very tiny percent of people who have been vaccinated. And when you look at other vaccinations like chickenpox and or the flu vaccine and tetanus and hepatitis A and B, you see the same kind of things unfolding, that millions of people get it. Tiny numbers have difficulty with it for a variety of reasons. They may be allergic to the components of it, like eggs is a common thing that flu vaccines are made with. So those allergic to eggs or eggs components shouldn't get it. But lots of people receive the vaccine and get the protection from it. And what I want to get a better sense of is what people have heard. What have you all heard about the vaccine? Because I think one of the things in moving from hesitancy to acceptance is getting all of our questions answered about things that you've heard or things that you're not sure about or that have come up for you. So as you're thinking about it, either put it in the chat or let it be known. And I want to take the time to talk about that too. So we remember we began hearing about this. Everything was COVID-19, COVID-19, COVID-19. And then one day in the news, Delta appeared. And I know many people were thinking, well, why this? One of the things about viruses is, and it's like the flu virus, each year it changes a little, that mutation, that change. So as it changes, you end up having to address the vaccine to cover it for flu. As it turns out, the same thing happened with the COVID vaccine, or COVID virus, because it is a virus that after a while it changed and they gave that name Delta. And what we do know about that is those that were sickened or infected with Delta got very, very sick. There was a higher rate of hospitalizations. More people went to the hospital, more people ended up in the ICU, and people were just simply sicker. And it was more infectious than the original COVID-19. As we continue to vaccinate and try to, because one of the goals here is that if you vaccinate enough people, the virus has fewer opportunities to mutate or change. But as it continues to go from one person to another, it will change. That's what viruses do. You name the virus, they have a history of doing that. That's how they survive. And then we heard in the news, Omicron. And I know this had to be devastating and fatiguing because we're tired probably at this point of just simply hearing about the impact that this is making on our lives. But we all know that it's real. So what we do know about Omicron, another change from the original COVID-19, is that it's even more infectious than the Delta change, but people seem to not be getting as sick. And the thing that complicates that is if you have a complex medical history, let's say you have diabetes, high blood pressure, let's say you had gout in the past, those medical conditions, should you get infected with COVID, gives the virus an opportunity to make you sicker. So that's why we know that people who have a complex or a lot of medical history, they tend to get sicker from this. And so they were made a priority too to get vaccinated because of that. So that's how the timeline and the change going from COVID-19, which you rarely hear about anymore, to Delta, which is still out there, to Omicron, which we're currently trying to deal with, which is more highly infectious, easier to pass from one person to another. But we believe now, looking at the data and when it was first identified in South Africa, that people don't seem to be getting as sick, but they're still getting sick and people still go to hospital. And the thing that we're trying to do is continue to vaccinate people so that we don't get another change, or what they refer to as a mutation in this. And that's really sort of the end game, if you will. How many people can we get vaccinated to prevent another change and another level of uncertainty? So we know we have what it takes to bring this to a standstill and minimize it. It's just getting people out there and getting their questions answered and having them make the decision to get vaccinated.
Hey, Chris.
Yes.
We have a question from your earlier slide talking about vaccines. I think when you mentioned egg allergies in relation to flu vaccine.
Yes.
Someone asked, why do they use eggs?
So in the flu vaccine, they don't use eggs for this current vaccine, but in the flu vaccine, eggs were the perfect medium. You could put the virus inside an egg and just grow more of it. And it was very efficient to use it that way. We now know that, of course, you have to deal with the fact that for some who are allergic to it, they'll never be able to get it. So some manufacturers still use that and others don't use it. But that's why it was used, is it was the perfect way to just produce a lot of vaccine for flu using eggs. And again, that's not used for COVID, but again, back when flu vaccines were first being manufactured. So who's getting COVID? Well, everyone. You name the group, that they certainly have been impacted. But I think the thing that we have to acknowledge here is the impact that it's made on Black and brown people. We seem to be getting it at a higher rate, getting sicker from it, and more of us are dying from it. And that to me was very scary. And again, very early on, long before it was the big news that it is now, I felt that when I thought about my half brother and his situation. So again, what we see in hospital these days, for the most part, are the unvaccinated folks. So unvaccinated folks who are not protected, are more likely to get sick and more likely to have to go to the hospital to get care. And I think I can say without a doubt, hospital is no one's favorite place. I worked in hospitals for years and that was my choice, but I can't recall anyone who was just so happy to have to come to hospital. So we just know that Black and brown folks have just been disproportionately impacted. More of us have seen the hospital beds, have died in ICUs. And remember that the odd part about this one is, because of the isolation measures, families are not able to be there with their loved ones in their last moment. And that's gotta be absolutely heart-wrenching. And I know what it was like when someone was dying in hospital and no one came to the bedside in their last hour, but to restrict people when they know what's going on and they can't be there to talk and to touch hands, that is just heart-wrenching for me. And it has to be for any of you who've been impacted by this or know someone who was in a hospital bed and there was no one there other than the hospital staff at their last hour. So it's the unvaccinated and some vaccinated. And the thing to remember is people who've been fully vaccinated still got infected. Some still got infected with COVID. But what did not happen is they didn't get severe disease, meaning they didn't require a prolonged stay or a large number of days in hospital, and they didn't need to go to the ICU, and they weren't placed on a ventilator. That's the big thing. And that's really the key feature of why all these vaccines are here, is to prevent severe disease, trying to prevent people from needing to go to hospital for a large number of days, and to prevent them from getting into the ICU and preventing them from needing to be put on a ventilator. That's really why those vaccines are there.
Chris, we have a question that kind
Yes.
of relates to that. Someone asked, can you provide data on the protection provided to Blacks who get the vaccine and booster? How does this compare to those who don't get the vaccine?
So specifically, African Americans who got vaccinated, and I'm one of them, enjoy the more than 95% protection of having received both vaccines if you choose Pfizer and Moderna. We'll talk about that later, or the Johnson & Johnson and the booster. And the second part of the question was, how does that compare to people who don't receive a vaccination?
Yes, how does this compare to those who don't get the vaccine?
It is literally like night and day for those who did not receive vaccination. They really fell into, like I would say, 30% had symptoms that caused them to need to stay home, and they kind of weathered through what was described in literature as heavy coughing and nausea and shortness of breath, teetering on the need to almost be in hospital. Whereas, and I think we look at New York, the lion's share of people who got infected with COVID were in hospital. The hospitals were pouring over. They took the regular floors where you would have your surgery and recover, or you would have like your bladder taken out, or a simple infection. And entire hospitals just simply became COVID hospitals to manage how sick people were, creating ICUs where they were never meant to be. And I was an ICU nurse for a long time, and I can tell you that it is difficult to take care of really sick people when you're not in an ICU and all the things that you're used to. So when I was listening to this, I could only imagine what it was like to have to face that day in and day out. So the numbers are like night and day. The lion's share of folks who early on got COVID and even the Delta variant were who were not vaccinated, were in hospital, were sick and stayed longer days than what they thought they were going to stay. And of course, they saw more and more people in the ICU and more people on ventilators. And so those numbers were just staggeringly high.
Thank you. And I've added from King County, our vaccination outcomes to the chat that shows, you know, some of the differences with our latest data on the impacts of vaccination versus not being vaccinated.
Great, thank you. So then we ask the questions and think about, so what if I get COVID? And I think there's essentially just two ways to look at this. What if you get COVID, but you're vaccinated? And what if you get COVID, but you're not vaccinated? Well, it is clear to me, and I will never be shaken from this, that if you get COVID and you have been unvaccinated, it's anybody's guess what your outcome will be, because there's so many things that play into it. We thought for a while that age was sort of a protectant, that the younger you were, the more likely you were not to be sick. But now we know that we're seeing people in their 20s and 30s and 40s with very high rates of COVID and being in hospital or being so sickened that they couldn't go to work. So that didn't pan out. And then we thought, well, children seem to be not so infected or affected by it. But then Children's Hospital here in Seattle was chomping at the bits at how much of an impact it had made on their health system, of the number of children coming in with advanced COVID disease that required a long stay in hospital, ICU care, and ventilator care. So compare that to if you get COVID, but you're fully vaccinated, and let's say you have some symptoms, and those symptoms may be a mild cough, maybe fever and chills treated by Tylenol or Motrin. You're able to keep your appetite, keep fluids down, and you spend days isolated at home. That's worlds apart from the trip to the hospital and where things may go depending on where it is the level of your disease or symptoms that you have, not to mention the cost too. So when I think about that, I always think about it in two ways. So when someone says to me, oh, my friend had COVID, the first question comes out of my mouth is, were they vaccinated? Because that makes such a huge difference in terms of what that person could possibly expect. But if they're not vaccinated, it's not as clear how they will be affected. Things like their age, their medical history, do they have high blood pressure, diabetes, any of those, lupus, if they've been treated for cancer, or if they're in the middle of being treated for something like cancer. All of those things really change what happens when the person, should they get infected with COVID. And so there are three types of vaccines. I think we've heard just about all of them. Johnson & Johnson was the one that I think a lot of people were initially really excited by, because it was a one injection and you're done. And we'll talk more about some of the issues around what came with Johnson & Johnson. Then Pfizer came on board, and they had they and Moderna used the RNA, mRNA technology to make their vaccines. And theirs were, you get 2 vaccines about 3 to 4 weeks apart, and then you're done. This is before boosters. And Moderna was the same, except that Moderna and Johnson & Johnson, you had to be at least 18 years of age to get that vaccine, where Pfizer now is all the way down to age 5. So staying safe during the pandemic, there are really things that we can do that really helps us stay as safe and as healthy as possible. Certainly at the top of the list, well-balanced diet, plenty of rest, fluids, and actually that's really for any day of the week and things we should be doing just simply to stay healthy, but certainly in this time and in this environment, certainly can only help. That 6 feet separation, particularly when you're out in the public, is golden and helps. Masks, and I want to talk a little bit more about masks as we get into that part too, are still very, very necessary. And again, as I talked about early, the thing with that is Omicron is that change in the virus is even more infectious than Delta, which is more infectious than the original virus, COVID-19, when we first began this. So masks play an extremely important role in staying safe and staying healthy. And of course, ultimately, being vaccinated. And if you put all 3 of those together, you have the necessary tools to keep yourself as safe as possible during a pandemic. Now, does this mean that you never will get sick? I will never say that. But what I do know is that these 3 tools are pretty much available to just about anyone and really work to keep people safe. And I think in our communities, it's not only keeping people safe, keeping people alive, and bringing down the numbers in a way that I think will just simply save lives. I think that's just the bottom line. And it still troubles me deeply that we're so affected and it impacts our community so much. So those 3 tools to me are like the cornerstone of what people need to have to remain safe. So let's talk about masks, and I want to stop this and
Chris?
am I just visible?
We can see your desktop.
Oh, but not me.
I can see, I have you pinned to the side of the screen, but yeah.
Okay. So I wanted to just briefly, I don't know if people can see in the little picture of me, masks. So first there is the handkerchief. And the handkerchief typically, is worn like this. And the problem with handkerchiefs is the material that they're made of, variable levels of cotton that isn't tightly woven. So it's not a very good barrier. And when you cough or sneeze or breathe, it gets through. The other ones that we have seen are the gaiters. And, people wear them over like this. And you'll see lots of people wearing gaiters. And the problem again is that the loose material that they're made of is meant to allow it to be breathable. And as such, it does not do a very good job at all at keeping virus in and keeping it from exposing it to others. So in my opinion, looking at this, these are your least effective tools that you should have. Having said that, it certainly is better than nothing. But if we know that there's something better out there that helps protect us, I would lean towards that. Then we come to the surgical mask. And the thing about the surgical mask is lots of people use them, and there still are a number of people who don't correctly use them, which is to say, over the face, under the chin, and over the nose, making sure you have that crease over the nose. So this is how it should be worn. You'll see lots of people doing this. The thing about not covering the nose, most of viruses, like when you have the flu or a cold, lives in your nose. So when we're breathing, if that isn't covered to filter, to capture, you may be exposing others to it, others may be exposing you to it. That is the beauty of these masks. There is some loss through the sides, but the point is that in my long career in healthcare, I've always worn these masks in hospitals, taking care of some of the sickest people with some highly infectious diseases, and I did not get them because I properly wore a mask when I needed to for protection. And again, some of you may see same thing, a mask that looks like this as well. And the gold standard, and these masks aren't as available, and King County Public Health, through some of their clinics, vaccine clinics, did make them available. And they're called the N95 mask, and they have sort of like an automatic crease to them. And the material used for this has such a high filtration that when you do cough and sneeze, like 99% of it is captured in this mask. So this N95 is sort of the gold standard. So if you don't have access to that, the surgical type mask is very effective, and would say that having this, you'll be very safe. Gaiters and handkerchiefs just simply don't do a very good job at protecting either you from someone else or someone else from you. So when you see that, in my opinion, when I see someone who's wearing a handkerchief or a gaiter, I increase that distance away from them, because it just simply is not an effective mask.
Chris, I just wanted to let you know that some people were seeing you too small, so I stopped your screen sharing.
Okay.
So I stopped your screen sharing. So you're not screen sharing right now. So if you're going back to your,
so I have to go back. Yes, I'm going to go back. Yes.
And while you're doing that, just because this is on the topic of not just keeping yourself safe, but keeping other people safe. Someone asked, how many days should you wait to be tested after returning from a trip? So kind of like that quarantine isolation information.
So, the recommendations around this keep changing. Let's say you cross the border, you go down to Mexico and you come back. When you come back, some of the literature would recommend that you would isolate from 5 to 7 days, and at the end of that isolation period to test. Testing when you first come back, you may be in this gray area where it's possible that, let's say you were exposed to it, but there's not enough of it to capture it on the test, and you would get what we call a false negative. But as one gets through the isolation period, quarantine, if that test remains negative, then in fact, you should be cleared to go. Likewise, let's say you return, you test, the test is positive, waiting that 5 to 7, and some will even say up to 10 days, testing again if you can, should clear it. So what we do know is that quarantine period is long enough for most people to clear the virus, and should test negative on a nasal swab. So those are the things to think about. Most of the time, people are more concerned about having had an exposure at work or in the house, and what they need to do to keep everyone safe in-house or at work before returning to work. And again, following those guidelines is to get people tested, and then have that period of where they are isolated or quarantined at home, and if they so choose to test coming back. And again, when it comes to employers, some employers may have those rules spelled out that in order to return, you need to present with a negative COVID test. And some employers may just simply say, having established that you've been exposed 5 to 7 or 10 days, whatever they're deciding to recommend, and then returning to work. And so for those concerned about the workplace, looking at what your employer has laid out is important as well. So those are the things about the masks. And again, the N95, and just that there's a lot of technology that goes into the N95 that makes it the gold standard, the best mask. These are the masks that I would say if you're traveling on an airplane, I would wear one when traveling on an airplane. But for the purposes of where you live in your community, the surgical masks that I talked about and demonstrated are very, very good and reliable. Then there's also the question about what if I'm pregnant or thinking about becoming pregnant? How safe are these vaccines? Will it affect the unborn child? Well, we now know in the women that were brave enough to enter a study who were pregnant that there were absolutely no effects seen on the unborn child or the mother, even if she breastfed. Now, the thing to remember about the vaccine too is the mother's immune system, although weakened during pregnancy, does transfer some of those antibodies in protection to the baby. And in the literature, it pointed out that the baby did receive some of the COVID antibodies through protection when the mother was vaccinated. Those antibodies, when the child is born, aren't going to last forever, which is why all of us remember being vaccinated, what seemed like a lot, but was necessary to help build that protection and immune system. So the study tells us now that mothers were not affected, the babies were not affected. And then there was a question about whether or not the virus would change the DNA or change genes. And none of that was seen, though that was talked a lot about in the media. And they didn't, in my opinion, do a very good job at just saying, let's pause. Let's talk about the things that have the power to change your genes or your DNA. It's stuff like radiation from a nuclear power plant. That's the level of stuff that should have been discussed in terms of whether or not it affects your genes or not. So that was my disappointment in how the media handled that, is putting it in that context would have made it very clear. Obviously, unless you're living very close to a nuclear power plant and there's a problem, you've been exposed to radiation, changes in DNA just simply don't happen through vaccination. So let's talk about the vaccine schedule and who should get vaccinated. And it begins with everyone above the age of 5, as we now know what's available. And I took this picture here and included it because, in my view, as I think about all that's happened and the people around me that have been affected by it, getting vaccinated to me is one way that I think shows that Black lives matter. Because it's the one thing that we have control over, that we have the power to do to protect ourselves, protect our community, and keep going. So again, the Johnson & Johnson or J&J is available to those who are 18 and older with a booster in 2 months after the first vaccination. Now, some of us heard about the issue with blood clots and some of the side effects given the Johnson & Johnson vaccine. First thought it was mostly affecting women, but then we saw men in their 30s and 40s had experienced some of those side effects as well. One of the things now that they're recommending is if you receive the Johnson & Johnson vaccine, that your booster should ideally be Pfizer or Moderna. If you so choose, you can still get the Johnson & Johnson, but they're recommending that Pfizer or Moderna be your boosting shot. Now, Pfizer, if you're 5 years and older, remembering that you get the first one and the second vaccine shot is within 3 weeks. And Moderna, you have to be, again, 18 years and older with the second shot or vaccination 3 weeks later. One of the things that was in the literature is, can you mix and match these vaccines? And they were very hesitant at first because, again, to use Mr. Davis's words, we were certainly in unprecedented, highly uncharted waters. But what I know, having vaccinated what seems like thousands of people, is we have mixed and matched vaccine types from manufacturers all the time, like with hepatitis A, hepatitis B, chicken pox, etc., and able to achieve by doing that even higher levels of coverage. So that was something that was slow to get unveiled, but now the recommendation is there is no harm that if you started out with Pfizer, your booster can be Moderna, and the reverse. If you started out with Moderna, your booster can be Pfizer. You can certainly stick with Pfizer for all three and Moderna for all three. But that's some of the talk around vaccinations that I think had been there, is whether or not you could mix and match, if you will, and how does this work in terms of the age? What Moderna is hoping to do is to see the age that they can vaccinate after their studies go down, and Pfizer is looking to even push it down into infants. And again, remember, in this country, the first vaccination that infants receive is their first hepatitis B when they're born. So we do know that providing vaccinations very early in life helps and helps protect.
Chris?
Yes.
I just wanted to give you a little time check, let you know that we are at about just over 10 minutes before the end of our session. I do have a couple of questions in the chat that I wanted to make sure I gave some time to.
Sure.
One of them you actually already answered, which is, does age group affect who gets the vaccine? So your timing was perfect on that one. And someone asked, this relates quite a bit to your conversation earlier about masks. Do you think, I think this is probably going to be your best guess, but do you think there will be a day in the future where we won't have to wear masks anymore?
Oh, I think you said it correctly. My best guess is I don't know, but one thing I do know is until we get our vaccination rates, not only in community level, in the city, in the county, in the state at a certain level, we can continue to expect to wear those masks. And someone had asked me about that, like, isn't it getting tiring to wear masks? And I said, if you told me I had to choose between wearing a mask for the period of time that we have to wear it or dealing with structural or institutional racism, I'd take the mask any day. So we don't know, and it's anybody's guess, but what we do know is we get a little closer to being able to better answer that question the more and more people who get vaccinated. That's the end game. That's where we're headed.
That's great. And maybe there will just be some things that will just be changed because, that's just what these types of unprecedented times do.
Absolutely.
Another question was, and I think you touched on this a little bit earlier in your presentation, but it would be lovely to get a little more clarification, is what's the difference between a virus and a variant?
So a virus is a DNA, like a gene material, and all by itself, it absolutely does nothing. It can only do something once it gets inside us. We are known as the host. Once it gets inside of us, it multiplies, makes more of itself, and is just aiming to get out and get to the next person. When it gets to the next person, it may change a little. That change oftentimes is described as the variant. So it doesn't quite look like the original. It's changed a little, but we still know it is COVID. This also happens with HIV, human immunodeficiency virus. Once it gets inside a host or a person and gets to the next person, it changes a little. It's a new variant. It may be harmless in terms of the disease level that it causes, or it may be resistant to all medicines. We don't know that until you take the blood sample and you look at it, which is what happened here with COVID. We knew COVID-19 was very serious, caused people to get very sick. Delta came along, that variant, that change made more infectious and people got sicker. And then it changed again, and now we have a new variant, Omicron. highly more infectious than the two behind it. But for now, it seems people aren't getting as sick. They still are getting sick, but maybe not as sick. So the variant really just speaks to that change. It's still we still would classify it as COVID, but it changes.
Okay, perfect. An earlier question was, how does, I think this related to when you were talking about people that have a higher risk of having severe illness. How does COVID-19 affect children with asthma? I think from personal experience, this person's sister got COVID and she has asthma.
So I can tell you personally, I have exercise-induced asthma, living here in the abundant world of greenery in Western Washington. And I was making a decision to go back into care, and my provider stopped me and said, you know, you have the one condition that has one of the worst outcomes if you get COVID, which is asthma. And the reason being is asthma is really this inflammatory or inflammation inside the lungs. And so when it flares up, there's more inflammation and people wheeze and cough, and they're more likely to get sick or get it like a pneumonia. You put COVID in there, it just becomes the perfect thing that it's looking for and really gets them and causes that severe disease that I talked about earlier, which will surely get them to need to have to go to hospital, possibly for an extended stay, possibly more likely to be in the ICU, and God forbid, the ventilator. So asthma is at the top of the list of the things that if you have, you want to make sure you get vaccinated, you wear a mask, you stay 6 feet apart from folks, because that risk is so real for anyone, whether it's a child or adult with asthma.
And I think onto that, someone says, I've got 2 questions in here that I definitely want to make sure I ask. So sort of adding on to what you were just saying, I have a 3-year-old and an 8-month-old, obviously unvaccinated. How concerned should I be about their health right now during this wave?
That's an excellent question. And I always think about it as our circle. So the folks that interact with your 2 children that make up the circle, these are the folks that you're going to see every day that you have contact with. Are they vaccinated? If they're vaccinated, then your circle is pretty solid. And so it means that those that can't be vaccinated, or those that the vaccine won't work as well in, let's say they're receiving chemotherapy for a type of cancer, the vaccine won't work as well because their immune system is being challenged by the drugs they're being given. Or if they're very young and they have a weakened immune system, it matters greatly if the people in their circle are vaccinated. And that really is their protection in that circle, is making sure everyone who gets around them has been vaccinated. That's how you can certainly protect them.
That's perfect. And after you were talking about masking and how the future of masking is uncertain, someone very wonderfully asked, so those that don't want to get vaccinated for whatever reason extends the likelihood we all have to continue masking?
So here is, and we'll cover boosters, but here is the pivotal point where we are. As we try to push people to get vaccinated to slow the spread, to stop the spread, to slow or stop changes or variants in this, the end game is that if we reach that point, the discussion of whether or not we need the mask becomes a very real discussion at that point. Without that, the best that we know is that wearing the mask protects. So that answer is just best answered as we see higher and higher rates of vaccination in community, in county, and state, and across the country. That's really the bottom line there. That's really the only way out. There's no other way out of this than using the very powerful tools that we have now. And the most powerful one is the vaccine.
Well, I think that is perfect. And as you're, I just want to let you know we've got just a couple minutes left. I want you to talk about boosters. And when you talk about them, if you could consider this question that just got posted with all the new variants, how often would boosters be considered?
Okay, so first, if you had the J&J vaccine, 2 months after you've had that vaccination, they're recommending that you consider either Pfizer or Moderna for your booster. If you've had the Moderna vaccinations, 5 months after you've had the second vaccine dose, you would come back and get your booster. And again, the recommendation is that you can stick with Moderna or consider Pfizer. And Pfizer, if you're 12 years and older, 5 to 6 months after the second dose, you can get your booster. And again, that booster can be the Pfizer vaccine or the Moderna vaccine. Whether or not we will need to continue to boost, again, not enough is known whether or not this will be considered like flu, that it's going to be around, and so we get vaccinated against it, or we vaccinate enough people and it sort of dies out and we don't have to worry about it. But there's just simply not enough known, not enough people vaccinated to really be able to honestly answer that question. So the end game is, of course, we working hard to get as many people vaccinated and boosted as possible. And again, boosters help to protect against severe disease with the Delta variant and now with Omicron variant. Delta variant, as I talked about, made people sicker and is easier to get compared to the first COVID-19. Omicron spreads easier than Delta, but people, when vaccinated, don't seem to get very sick. And that's really the key, is that even if someone happens to get Omicron, if they're vaccinated, they're not likely to get very sick. And so we know that the power of that booster is just so important for that reason alone. So let's say you said, what are my choices if I decide to delay getting vaccinated? So again, we're back to those other tools we talked about. Masks. And again, not gaiters or bandanas or cloth masks if you have access to surgical masks. Social distancing and testing. Those become your tools. And now keep in mind that we're approaching a point where basically to go inside a restaurant or other venues, people have to show their vaccination cards or recent negative tests within 24, 72 hours, whatever they're looking at. Most of them are saying 72 hours. And some are demanding within the 24 hours to get into certain venues. So those become your tools. And I can tell you from folks that I know, the testing part, like right now, is very difficult to keep up with because the demand is so high. Testing centers are just inundated, overflowing with people wanting to know their status. They've been exposed or have symptoms and just simply want to know. So those become your tools if you decide to delay getting vaccinated. And I want to end with, I want to go back, sorry. Yeah, I want to end with this picture. This is a picture of my son, and he's getting his booster. And I picked this image because I think about all the things I worry about for him that we worry about with each other, whether it is institutional racism, structural racism, God forbid any interaction with the police, because we still choose not to live in denial about the possibility of an unwanted interaction. There's so many things that we have to worry about. But the one thing that I felt like I could do for him, and we did for each other, was to take this issue of COVID off the plate. It doesn't mean that it's never going to come back or that we won't have to deal with it, but it's less of a worry. And I felt like it was the thing I could do for him to protect him against, when there were so many other things in the world I'm almost powerless to protect him from. So it meant a lot to me as a parent to do this, to make sure there's that one thing he won't have to own, we don't have to own, because we're vaccinated and safe. Any other questions?
Yeah, we have just one last question. I'm not sure if you could clarify a little bit. The question is simply, can you speak on the fake vaccination cards? Um,
Well, all I can say is I've heard that they're out there. I've never really seen a fake vaccination one. What I do know is as we move along in this, it's becoming more and more difficult to do that because a lot of these vaccination cards are entered into the state vaccination database, which we've had for decades. And so people may be there will probably come a point where we'll rely simply on the database to see if people are vaccinated. And again, in these unprecedented times, we're looking at lots of tools, but I've never seen one. I've seen them on TV, but when you work in the vaccination centers and you do pop-up clinics, you only see the real one. So if you showed me a fake one, I probably could spot it as being fake, but I've never seen one.
Thank you so much, Chris. I think that's, we were having a little bit of a conversation about how much money these CEOs were making throughout the course of the pandemic. But other than that, I think you addressed all of the questions that we have this evening.
So I want to thank everyone for taking the time in their afternoon and evening to come listen to this. I hope it was helpful information. If you're thinking about why should you vaccinate, I hope I've been able to provide you some more information to help you make that decision. What I do know is the only tool we have to truly protect our community and those we love, those in our circle, as it turns out, ends up being the vaccine. Yes, we can use masks and social distancing, but that vaccine on top of that is the thing that makes the difference, that saves the lives, that keeps our circles intact. So thank you so much for coming out this evening.
Thank you. And Tamia, did you want to make some closing remarks?
Yes. Well, first and foremost, thank you all for showing up for this important presentation. We hope you receive valuable information on how, why, and where to get vaccinated against COVID-19 and all its variants. The goal is to eliminate this virus so we can get back to a sense of normalcy. Many places of employment, such as medical facilities, airlines, etc., are mandating vaccinations against COVID-19. We can get back to that sense of normalcy if everyone gets vaccinated. And thank you to Chris Porter, Belinda Primus, King County Public Health, and Rainier Beach Action Coalition Smooth Operators team for coordinating this info session. This work is very much appreciated. And if you need any help, please contact RBAC at info@rbactioncoalition.org for resources relating to COVID-19 and or vaccination clinic locations. Thank you.
Yeah, TS.
Don't do all that, Neil.
Hi, I just wanted to say, I am from King County Public Health. My name is Belinda Primus. I wanted to thank Jamie for helping to participate in this event as well. She did a lot of work. And Chris, you were wonderful. The RBAC team, wonderful. And Gregory, most importantly, you introduced me to the Smooth Operators and gave us a chance to meet them and put on this presentation. So I'm thankful for that. And to everybody that showed up, I hope you got information from this that you can walk away with and feel more educated about COVID-19 and the information that Chris shared. And we want to do more of this. We want to hear from you. So we want you to talk to the RBAC team and let them know, you know, what else you want to know. What else can we, what other pieces of information can we provide you with? Because we want to keep you armed and we want to keep you in the know, and we want you to be safe. Okay. And that's the most important thing, that we want you to be safe and know where you can tap into your resources. You can always go onto the King County Public website to find out, areas where you can become vaccinated. So the information is there and we want to keep you informed. And thank you for allowing us to be a part of your lives tonight. Jamie?
Oh, Belinda, you covered it beautifully. This was such an honor to be here with you all this evening. Really such an incredible group, wonderful questions, wonderful engagement. Really, really incredible. I don't think there's anything else I can say. I think you all did it already. You're awesome. I'm gonna go ahead and turn off the recording now. So if there's anything that someone wanted to say outside of the recording, I'm gonna stop that right now. Okay.